Magenta is a study where we wanted to make genetic testing for cancer risk more accessible. So our idea was to bring genetic testing to women in their home. The traditional paradigm where patients have to come in, have an appointment, get their blood drawn, then come back for a second appointment to get the results. We wanted to overcome that barrier. So we wanted to bring genetic testing to patients in their home. And I think in the days of COVID, we were trying to increase convenience, but I think now we could say this could be done in the safety of your home. To do that, we wanted to assess what's the best, can we do that with little harm to the patient? Can we provide them the benefit of that information without creating stress and anxiety? And what's the right amount of information that patients need to do that? So a little bit of a surprise was that personalized telephone counseling, where a subject could talk to a person who is an expert in the genetics before they got the test, and then again after they got the test to receive their results, was not necessary. And patients had no increased anxiety or stress if they skipped that counseling process and just received online genetic education. Ovarian cancer is a very deadly disease, and we don't have early detection to help women detect it early. So our best chance for decreasing the mortality of ovarian cancer is prevention. And in order to prevent ovarian cancer, we remove the ovary surgically. But we don't want to do that for women who just have a normal risk of cancer. We want to target that for women who have an increased risk of cancer. And genetic testing allows us to document a small subset of women that have a very high risk of ovarian cancer. And those cancers can be entirely prevented if we identify their risk. One limitation, I think, of Magenta is that what we found was that the vast majority of our patients were white and highly educated. And while we do want to make genetic testing more accessible to those patients, it's also really important to realize that patients, that genetic risk is not limited to Caucasian patients, and that we need to provide this information across the board. That's a next step for us, is to try to see how we can access underserved populations and populations that are not primarily English speaking, for example, or don't have high healthcare literacy, or just don't have familiarity with genetics in any format. To me, every woman that dies of a hereditary ovarian cancer is a life unnecessarily lost. I've lost too many of those patients myself. And so making this testing more accessible for me is an opportunity to save lives.